treated for anxiety or depression always have something, always I guess is a little bit strong of a word, but usually have something that set that off. I mean, someone who's born into an environment that everything's pretty smooth.
I would say always isn't accurate.
Yeah. I mean, there's usually something that happens in
the
home.
You're not born an addict, and you're not born,
Yeah.
you're not born with PTSD. You're not born, everything is circumstantial and what, the situations in life that you go through. So, I mean, and it's figuring out what that is. What is that thing that's causing that, that underlying issue that you've had to use all these other coping mechanisms to, to cover that up. And typically it's something very traumatic.
Yeah. Hi, welcome this week to the Naked Doctor Show. I'm Dr. Tammy.
I'm Lauren.
We have a great show for you this week. We are addressing National PTSD Awareness Month. Mm-hmm. And for those of you who don't know, PTSD stands for Post-Traumatic Stress Disorder. Mm-hmm. One of the things that's come up is we're doing the cannabis certifications at our office, and one of the indications on the medical reasons for getting a cannabis card,
qualifying condition,
thank you, is PTSD. And unfortunately, anxiety and depression aren't really covered, but those wrap so much into the diagnosis of PTSD. So if someone hasn't had the diagnosis formally made of PTSD, just a few questions kind of ties that together. So if you are having anxiety and depression, we can evaluate that.
And I'm glad we get to address this topic because this is something that I feel like is people don't really have an accurate perception of what PTSD is. It's really tied into the military typically, but it's so much more than that. Yes, it's a condition that that's used a lot in the military, but military is definitely not the only people who suffer from PTSD. So I'm excited to get more into that.
And even if you're not interested in cannabis or getting a certification card, an understanding is really important for getting the help that you need and addressing some of those issues, which can be quite debilitating for some people. So we'll be right back in just a minute with the Naked Doctor Show.
I fell 18 and a half feet, scattered my right ankle into 23 different pieces. That, of course, affected my knees, which affected my hips. And then I have a back injury and a neck injury and a shoulder injury. And I was in severe pain most all day until I could actually lay down and get off of my body. The stem cell therapies within hours actually turned around to where I felt like almost 90% of the pain in my body was gone. I could walk. I could walk without pain. I then came back and did a stem cell IV, which came in and affected all of the other parts of my body. And at one time I was a smoker. Since then I have felt a large difference in my lung capacity, in my breathing, in my stamina. It's the most amazing thing that I've ever come across in my life. And one of the things that I say is you will love Dr. Tammy. She is the sweetest person you'll ever meet, and she is not your typical doctor. She makes you feel like you're at home. She actually gets to know her patients, knows their lifestyle, and tries to work her treatments with your lifestyle so that you are happier and more productive on what you're doing.
Hi, welcome back to the Naked Doctor Show. I'm Dr. Tammy.
I'm Lauren.
We're talking about PTSD or post-traumatic stress disorder today, and it's a very common thing. And like you said before break, there's so many misconceptions about what that is and the stigma attached to that.
Yeah.
Not alone if you're trying to get a cannabis card, the stigma that is floating around for people and causing some issues.
Right. It's almost like I see a lot of people almost kind of feeling too ashamed to, like it doesn't even cross their mind to think that they have had post-traumatic stress disorder because, and when you tell them that, they're like, I wasn't, like, no, I don't. I wasn't in the military. I'm not in the military. You know what I mean? It's like I see this reaction a lot from people, and it's like, it is not just a military thing. Yes, you just hear that stigma a lot with people who are in the military and whatnot, but there are a lot of things, I feel like we all go through some kind of trauma and deal with it in whatever way that, whatever coping mechanisms that we've learned to deal with stress and trauma in,
And you see that a lot as a life coach in our center, that I'm sure they come in and talk to you about a lot of those things that you're probably making the diagnosis of PTSD all the time when someone comes in with stress, anxiety, or depression, or they're trying to lose weight, or they're trying to get their hormones balanced. And I always say thoughts become emotions, become chemical changes. So at some point, that trauma that's created creates those emotions, which creates those chemical changes, which then brings them here a lot of the time, not just for cannabis certifications, but for hormone balancing and for diet, nutrition, and all the things that start affecting them as well.
And one of the greatest things to help recover or heal from PTSD is cannabis.
Yeah, absolutely. Most of our patients, and I've seen hundreds, if not thousands, I don't know, hundreds.
Hundreds of thousands.
Yeah, hundreds of thousands are just coming in to get legal. And they're already telling me that it relieves their symptoms and that without it, they probably couldn't function. What's really interesting is a lot of people, it's taken years for depression to be okay and acceptable, just to say that as a diagnosis. So we've come a little further. Stress is not a big deal because everybody kind of thinks everybody's got stress. So anxiety is not a big deal because that's kind of attached to stress-related anxiety, and people are okay with that.
I feel like that's something that's also come up more recently as well, is realizing like what anxiety is, and the fact that like so many people have anxiety. It's like more talked about than I feel like it was in the past.
Oh, sure.
But yeah, sorry, go ahead.
The correlation to PTSD is interesting, though, because a couple of things that have come up is people say, I don't want that on my insurance, or that as a pre-existing condition.
Right, like there's a shame. Like there's...
Yeah, or that they're going to be affected somehow. And it's like, okay, well, you have depression and anxiety, and you're like on 5 different medications. The insurance companies already know, like making the diagnosis of PTSD is not a stretch from that, you know, and why not get the help you need?
Right. Is it like, does it seem like it's so traumatic that like somehow your insurance is going to go up because you're diagnosed with PTSD? Yeah. That in itself is traumatizing.
Yeah,
you know what I mean? To have to worry about those things.
For sure.
And we've talked about, like one of the things I was talking about in the cannabis show is that I feel like a lot of the people who are the most scared to come in here and get their cannabis certification are people in like the baby boomer area, because they went through the reefer madness, and that in itself was so traumatizing. And basically, whenever you found a medicine, you've maybe self-medicated whatever with cannabis and found some peace in the world with cannabis, and like lived your entire life having to hide that fact, because if if somebody discovered that you were smoking, then suddenly that piece turns into imprisonment or whatever. And I mean, talk about having stress your whole life and not even really like realizing it. But that's something that's you hold on to. So unraveling that from those people, and for them to get in here and like have to admit that they smoke or that they need to smoke. I mean, that's you have years of trauma that have made you be quiet about that. So I imagine that being a hard thing to do.
And most of them self-medicate with alcohol, which is dangerous. It hurts the liver. It'll kill you. Cannabis has no lethal
But it's
dose.
legal. So
But it's legal.
So it's, of course somebody's going to do that and feel okay or better about that. And, and it's like, man, that's the opposite of what you should do in that situation.
Well, and people who treated for anxiety or depression always have something, always, I guess, is a little bit strong of a word, but usually have something that set that off. I mean, someone who's born into an environment that everything's pretty smooth.
I would say always is an accurate.
Yeah. I mean, there's usually something that happens
You're
in
not
the home.
You're not born an addict, and you're not born.
Yeah.
You're not born with PTSD. You're not born. Everything is circumstantial, and what the situations in life that you go through. So, I mean, and it's figuring out what that is. What is that thing that's causing that that underlying issue that you've had to use all these other coping mechanisms to to cover that up, and typically it's something very traumatic.
Yeah.
Well,
and what's traumatic for one person may not be traumatic for another person. So just because you weren't in the military and stepped on a landmine, or saw your buddy get killed does not mean that you don't have some sort of trauma that has initiated some sort of post-traumatic stress reaction. So the word disorder, I think, often just kind of makes people puts that stigma on it. So if you have some post-traumatic after a trauma stress reaction, then, I mean, that's the diagnosis. I don't really like calling things a disorder, but that's enough to say that you need something for that. And whether that's a natural supplement or it's a hormone balance situation. I love things like fish oil. We have a supplement called Brain Booster in the office that's got a lot of things that can boost serotonin and help with dopamine reactions and all those chemicals that get set off as well.
Another one that we have is 5-HTP, which is also helpful.
Yeah.
It helps with your serotonin levels and whatnot as well. So
yeah, absolutely. And there's lots of natural things that you can do that way. Cannabis is certainly one of those things.
I think everybody should have a cannabis certification. Or it should just be recreational because and that's not coming from just I'm a butthead or what. No, it's like I genuinely see the effects and the greatness that comes from cannabis. It's like, I mean, have you ever seen anyone mad on cannabis?
No.
Like, can't we all just get along?
In fact, I was just in Colorado a few weeks ago, and it's like, I haven't really spent much time in Colorado, but I was
why
like,
is everybody
everybody's so
so
happy.
nice? I don't get
They're all in cannabis.
That's so true, though. This world would be, a better place. There's a reason that in Jamaica they sing about love and
Be happy, man.
being happy.
So I think it's probably a few minutes till break, but when we come back, I want to go through what the criteria sheet looks like. And this is called the DSM-5. And this is the criteria that psychiatrists use when they're making certain diagnoses, whether it's schizophrenia or, whatever other label we're going to attach to the way people respond to some traumatic stress reaction. But you don't have to be a psychiatrist to make this diagnosis. Any family physician, any doctor can make this diagnosis. Because some people are like, well, I've never been given the diagnosis of PTSD before. So, it's always nice when people bring records, or especially if they've been treated for some psychiatric stress reaction, illness, or something like that. But based on the history, we can definitely make that diagnosis. And there's just several little questions that we have to go through. But almost everybody who has anxiety or depression or has had any kind of severe stressful situation in their life, or a stressful situation that they deemed extremely stressful. Again, everybody's different. So one kid that grows up in an extremely abusive environment may not have any issues hardly at all, or, the other. I heard this story one time about twins that were raised by an alcoholic parent, and one of them turned out super successful and one ended up an alcoholic. And they asked the alcoholic, why are you an alcoholic? And he said, because my dad was an alcoholic. And they asked the successful twin, why are you so successful? And he said, because my dad was an alcoholic. So everybody's a little bit different, but this is a nice criteria that we can go by, that we can establish a medical criteria for cannabis. And again, I agree, it should be recreational.
We'll
But-
get there. We'll
but
get there eventually.
While there's a need for me to do this, I'm
Yeah.
happy to do it. And I think this is really important to understand this and remove some of this stigma around it.
Totally.
Okay, so we'll take a little break and we'll be right back with the Naked Doctor. Hi, welcome back to the Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
And we're talking about PTSD or post-traumatic stress disorder. Also post-traumatic stress reaction to something that's happened.
PTS.
PTS. So the DSM-5 criteria, which the DSM is it's a diagnostic mechanism for, it's a huge book, actually it used to be, and they start out with the DSM-1 and all the way up to 5 because we keep adding all these diagnoses. I think that I think it's better in the psychiatric world for people to address the traumatic event.
Of course.
And to heal and not to dwell on it and keep going to therapy for years and years, but to recognize what has triggered this, heal from it, move on, have a happy life. Don't label yourself. It's kind of like, when you label a kid with autism who's maybe a little socially awkward or has had some sensory challenges, you label them with that, they become victims and they use that as an excuse.
Well, yes. And that is a huge thing. And that's where, when coming into, when I see clients and stuff and, it's really understanding, where your trauma comes from, but then yes, also not being a victim to it. Because, when you're a victim in your world, you don't even realize it, but you're actually causing a lot of issues for everyone around you when you victimize yourself, but even though you feel like the victim, you're really actually victimizing everybody else.
Yeah.
And there's so much more deeper stuff into that that we'll get to another time.
Yeah, we can do that another time.
However, yes,
But
it's very
I think
important.
it's interesting that you told me one time that you are a victim of abuse for whatever circumstance, but you don't have to
Victimize yourself.
which is a completely different thing,
Right.
which is recognizing, like you said, the trauma. Cannabis in one way can be kind of helping you cope. And so I think it's always important to address the issues and to move on and heal from those and not be a victim or use that as a crutch. But I also feel like if you can change the chemistry just a little bit, relax, get better sleep, because we talked about on other shows about the hierarchy of needs. If you're not sleeping well, you're not going to handle stress throughout the day. So it's like it has so many little facets to how it can actually help you as well.
Cannabis. Yeah, and another thing with cannabis when it comes to your trauma and everything is that it really allows you to get to really self-reflect and not feel shame in yourself and not and really let down walls that your ego has built for whatever protective coping mechanisms. And so being able to address those things internally and feeling safe to look inside yourself for those things that's a huge part of facing the trauma that you've been through. Sometimes we need something like cannabis in order to even accept something or to face it without feeling the shame or the guilt or the fear,
Right.
So I think that there's so many great aspects of cannabis.
The cool chemistry, and this is not the cannabis show, it's about PTSD, but the cool chemistry about cannabis is that it keeps you from looping on the negative obsessive thoughts. And so that thing where people say it affects memory, it's not long-term memory, it's short-term memory. Like you kind of, hey dude, you forget what you're
They're
saying.
like in the middle of something like,
But it's also that process in the central brain that helps with the looping. You kind of forget the negative loops. And so,
where alcohol would be the opposite.
oh yeah, you go dark
Alcohol
and
makes-
depressed.
Alcohol is like, oh, let's just get in that and just swirl in the darkness. But yeah.
So I want to kind of get into this a little bit so
Okay.
people understand what they're going to be
asked.
when they come in, and we're trying to establish this. And the first thing was, the first criteria is a stressor. So I usually ask people, you don't have to go into great detail, but when was the first time you really felt a lot of anxiety? And sometimes that goes back to childhood. And there are some people who don't want to say that they were abused as a child.
Well, they don't see it like that.
Yeah.
That doesn't.
Or they don't want to, they're kind of conflicted because they love their parents or they love their siblings, and they don't want to put that label onto something someone did to them. So even though they were abused and they were victims, some people, especially, people in toxic relationships, we talked about this, are just really good at not victimizing themselves to the other extreme where they can't recognize
That they actually are the victim of
that
abuse.
they were abused.
Yeah.
Yeah. So usually I'll have them just kind of describe an event, and we might have to go back to childhood, we might have to go to domestic violence. Not everybody has a military extreme experience. I had a lady one time who was diagnosed with HIV. Extremely traumatic. I've had people who were incarcerated and went to jail and faced that, or I've had people who had deaths in the family, all the way to just really extreme stuff that kind of freaked me out a little bit, from kidnappings and all sorts of crazy things that can happen to people. But so once you describe the event, which is usually a threatened serious injury, or could be sexual violence, could be just about anything, but it's usually got to be some sort of direct exposure, witnessing it in person, or it could be indirectly by learning that a close friend or relative was exposed to trauma. So if you found out that a close friend or relative had died, that could be traumatic for you. You weren't actually witnessing the death, but the trauma that kind of backlashed, or the stress that backlashed from that, for example. And if it was an event that involved or actual threatened death, usually it's something violent or accidental. So in that case, if you have a family member, say, if it's not direct exposure, something that you witnessed, usually it's something pretty traumatic to the event of a threatened or, accident or life-threatening something. Repeated or extreme, or direct or indirect exposure to extreme things. Child abuse could be variable, of course, but this is kind of creepy, but it's like first responders collecting body parts, professional, repeated exposure to details or things like that. So it can go from the mild to the extreme. And then criteria B is intrusion symptoms. So these are things like recurrent, involuntary, persistently re-experienced memory. So you see something, it triggers, like military people might hear fireworks and get, freaked out a little bit. Or you might hear a parent fuss at a kid in a store and, kind of relive a traumatic event. Traumatic nightmares are very common. Intense or prolonged distress after exposure to traumatic reminders. So let's say you were abused as a child, and, the abuser or the uncle or whatever comes to Christmas dinner, and you revisit that traumatic experience. People, places, conversations, objects, or situations that may trigger that. And then criteria C is avoidance. So these are things like traumatic thoughts or related feelings, external reminders, again, things you might want to avoid, like the uncle coming to dinner, for example. And then criteria D is negative alterations in your cognitions or mood, which that's just a fancy way of saying I hate life, or I feel bad, or I cry, or I'm depressed, or persistent negative trauma-related emotions like fear, horror, anger, guilt, or shame, which comes a lot with victims or abuse. Depression, anxiety, inability to recall key features, we call that dissociative, or people who self-medicate with alcohol or drugs to sort of suppress that. Criteria E is alterations in arousal and reactivity, and the best example is like military people who hear fireworks. Hypervigilant, trouble with concentration, trouble with sleep, trouble staying focused, self-destructive or reckless behavior, irritable or aggressive behavior, or hypervigilance, very, hyper-aware or exaggerated startle response is very common. Criteria F is persistence of symptoms more than 1 month, so it can't be something that happened 2 weeks ago. It has to be at least a month ago to fit this criteria.
So you can't like have someone slap you in the face and then come in and be like, they slapped me and it's very
Yeah,
traumatizing.
a week ago. That's PTSD. And then the criteria of that would exclude you is if you have alcohol abuse problem or drug addiction, and the traumatic thing was related to that. However, I don't really agree with that because a lot of people self-medicate because of the trauma, but this exclusion criteria would be that you're not feeling the PTSD symptoms because you're drunk or overdosing or something on some drug. And then depersonalization, which is just kind of feeling like outside. Cognitive dissonance, which is just pretending it didn't happen or just kind of getting through an event. So these criteria are really easy, and it fits a lot of things that go with anxiety and depression. So we can make that diagnosis here, or you can come with a prior diagnosis from the military. Some people are on disability for this. So it's always nice if you bring records, especially if you've been treated for anxiety or depression. It makes our job a whole lot easier when we make that diagnosis.
Yeah, I just don't, you don't have to feel shame in the trauma or abuse, or if you don't want to call it abuse, anything that you've been through that has caused you a lot of pain, mental, emotional, physical.
Sure.
And
I've heard it all. You're not going to surprise me.
Right, I was going to say.
I mean, if you do,
Right. She'd be shocked if she
I'd be
gets shocked.
if I get shocked.
So, yeah, and it's just, and this is a safe place,
And you don't have to
that's-
go into great detail to fill out this criteria. I mean, you can just generalize things a little bit. So it's not like you got to revisit and bring out the Kleenex.
We don't
or
want to cause
anything.
more trauma. You tell
Exactly.
talking about your traumatic story or anything like that. So don't feel any shame or worry about that.
For sure.
Come see us. And
even if you don't want cannabis, we have lots of other solutions as well to help you in life coaching and
Right.
things like that. Probably saying it's time for a little break, so we're going to take a break and come back with our close, and we'll be right back.
A few months ago, I went to Dr. Tammy with some foot pain. I had inflammation on the tendons. She recommended PRP. And we tried it. A week later, I had no pain. Till now, I've had no residual pain. I think it worked very well.
At Christmas time, I went in and I saw her, and we did a stem cell PRP and in my hip and my shoulder, and it was like a week later, it was, I felt so good. I wasn't able to sleep with my arm up or anything because it hurt so bad to put my hand behind my arm, and the joint pain is all gone in both areas.
After using Dr. Tammy's services, I've been extremely pleased. I've had nothing but good things to say about her, and I will continue using her in the future.
I recommend if you're just feeling old, tired, and the daily grind is getting you down, just go see her. She's life-changing.
Okay, welcome back. We've had a great show today talking about PTSD or post-traumatic stress disorder, all sorts of solutions for that. Don't be ashamed, don't be embarrassed. We can help. We have lots of solutions for that. You can check us out on our Facebook page, The Naked Doctor.
Facebook, YouTube, Naked Doctor Show, Instagram. So follow our Facebook page. You can also see us at Healing Arts Centers on all social media forums. Visit our website, healingartcenters.com, and coming soon, thenakeddoctorshow.com.
Yay! Excited about that.
I will have that very soon. And our show now is Monday, Tuesday, Wednesday at 12:30. And it's probably one of those days right now at that time if you're watching this. So, so no longer at 11, we're at 12:30. Still on the weekends as well after SNL. So don't
Tell
miss
your
us.
friends.
Yeah, tell your friends. Record us.
Email us, talk to us, comment, tell us what you'd like to hear more of. We've got lots of great topics to share. It's been a great week. Thanks, guys. Have a blessed week, and we love you very much. And we'll see you back here next week on The Naked Doctor Show.
Thanks for watching.